ladies and gentlemen, I think we're going to start. It's a pleasure for me to welcome everybody who has come to this event, and we are very delighted that we have alumni who have come, who have qualified. I think the oldest alumnus is one who qualified in 1953. Although I would welcome anyone who can improve on that, up to last year. So a whole 65 years of graduates of the medical school. I do also want to make a special acknowledgement of several colleagues, starting with Dr. Stuart Saunders, who is in fact the alumnus who graduated in 1953 from here, and I think we should give Stuart a big hand. And that's the reason we thought that he's an appropriate person to give us some reflections of all that period of observing things here in the faculty. I'd also like to acknowledge my predecessors who are here, Professor J.P. van Niekerk, who was the Dean of the faculty. I think JP is hiding there. Yeah, and as well as Professor Marian Jacobs. Thank you very much, Marian, for coming and participating in this event. So, as all of you know, today is Founders Day. June 6th is the day on which the faculty started operations out at Heading Campus on the 6th of June 1912. And therefore, we felt that it is important for us to acknowledge our founders, but most importantly, our alumni for the major contributions that they have made to the work and the life of the faculty. And this is part of the reason we're here, because behind me here we are going to acknowledge alumni who made special contributions at the time of the Centenary. It is also a time to celebrate important landmarks in the history of the faculty. This year is the 75th anniversary of Shoko, and I'm sure many of you participated in the work of Shoko, and we will have some input from the Shoko team on that. And it is also the 40th anniversary this year of the declaration of Alma Ata, which was the Primary Healthcare Declaration. The faculty has adopted that as the lead theme, and we are recognizing that this year. So we will have an input from the team from the Primary Healthcare Directorate on that. Now, in terms of reflecting on the achievements of the faculty over this past 106 years, I'm sure there are 106 and more reasons for us to celebrate the achievements of the faculty. But I thought that there are 6 achievements that really stand out in the work and life of the faculty, starting way back in the 1950s, on July 1, 1957, when Alan Cormack unveiled the first prototype of the CT scan in the old main building, what we call the old main building now, of Krutskia Hospital. And as we all know, Alan Cormack went on to win the Nobel Prize in Medicine or Physiology in 1979 for this great achievement, which has really transformed imaging and continues to do so to this day. And then the other landmark, it was on March 15, 1964, when South Africa's first successful separation of conjoined twins at Red Cross was performed. And of course, subsequently, on December 3rd, 1967, the famous first heart transplant by Chris Barnard. And on January 1, 1975, Professor Harrison in anesthesiology discovered dantrolene as treatment for malignant hypothermia. And we must also recognize Professor Francis Ames, who on April 1, 1980, together with her colleagues, successfully challenged the SM disease position at the time, not to discipline the doctors who were involved in treating Steve Biko, really again setting a very high standard for all of us in ethical conduct and ethical practice. And then I think more recently in the faculty on October 10, 2013, there was this discovery of the new species of pathogenic fungus that causes disease in people infected with HIV, which was discovered by Dr. Chris Kenyon and colleagues, and really setting a new chapter in the in the disease conditions that affect people with HIV. But of course, we are about the present as well as the future, and I hope you have seen a snapshot through the tour that you took this afternoon of the developments within the faculty. And those of you who visited the Pathology Museum as well as the Clinical Training Center will have seen new ways of teaching and training our medical students. Those of you who went to the IDM and other laboratories will see that we are at the cutting edge of facilities that for research in the faculty, both clinical as well as basic research. And those of you who went to see the new pediatric intensive care unit at Red Cross will also see that we're working hard to make sure that in terms of clinical services, we are at the leading edge of providing high quality of clinical care. The faculty itself has changed over the years. It is a place now that trains at least 2,000 undergraduate students. We have 2,400 postgraduate students, and as well as about 2,000 staff drawn from UCT, from Krutzke Hospital, as well as the NHLS. And in terms of our priorities for the future, we are working to ensure that there is access to the health sciences for our undergraduate students, and indeed we're grateful to you as alumni for contributing to the efforts that we've embarked upon to make sure that we ensure there is access to education for our students. One of the funds that we have been promoting and supporting is, for example, the Impilo Fund, to which many of you have contributed. And then in terms of staff, we are in constant work with our partners to ensure that we grow at the level of staff. And our fundraising efforts are also concerned with making sure that we have a pipeline of staff who are going to replenish the leaders of the faculty. In terms of facilities, the faculty, in terms of the infrastructure that you see, is really at the moment brimming at the seams, and we need new facilities, we need new buildings to make sure that we continue as a faculty to grow into the future. So through this event, we're really inviting members of our alumni to be part of this work of the faculty as we move forward, and to participate in ensuring that we've got a strong faculty into the future. So with those remarks, I hope we will continue to work together in making sure that our faculty continues to be the leader in the region, on the continent, as well as in the world. So I thank you for coming, and now we will move on to the other contributions by the other speakers. Thank you very much. Now I'm going to invite James Earlham from the Primary Healthcare Directory to just make a few remarks about primary healthcare. James, over to you.
Thank you. Thank you and good evening. My name is James Earlham, and I'm Deputy Director of the Primary Healthcare Directorate. And with my colleagues here, we are here to recognize the fact that this year, as the Dean has mentioned, is the 40th anniversary of the Alma Ata Declaration on Primary Health Care. It was a revolutionary declaration, and the principles are as relevant today as ever. We live in an increasingly inequitable world, and the vision of health for all, by which we recognize the full definition of health as being not just the absence of disease, but recognizing that there are many determinants of good health, is something that we want to continue to promote within the faculty. It's integral to the faculty's vision that we recognize primary healthcare as a lead theme. In 1994, the faculty and the Special Faculty Assembly adopted the primary healthcare approach as its lead theme for teaching and research and social responsiveness. And so what we've done in this anniversary year, the 40th anniversary of primary healthcare, is to design a program of events for the second semester that will be inclusive in inviting all departments to be part of saying how they are part of the ongoing vision of primary healthcare within this faculty. A commitment to ensure that equitable, evidence-based healthcare, multidisciplinary, intersectoral collaboration is part of our vision. And so we've designed a video project, and we invite you to come and view 2 of the short videos that have been produced that are showing here in the venue opposite me. These showcase stories of our students in action, working in communities. There are also some still photographs on the display boards behind you that tell a bit about how students are continuing to take forward the vision of primary healthcare, so that we remain relevant, that we are equipping our students to be leaders of tomorrow. If you have any further questions, myself and my colleagues will be on hand to answer those, and we trust that you will enjoy the videos. Thank you very much.
Thank you very much, James, for those words. And now I'm going to invite James van Duren from Shoko to speak about Shoko's 75th anniversary. Over to you.
Thank you. Good evening, everyone. I am James van Duren. I'm the current health sector president of Shoko. Shoko is something that many of you will have learned about at your time at the faculty, or it might be something that you've heard about more recently through some UCT news articles, etc. But what Shoko is the Students' Health and Welfare Centers organization. I think it's quite appropriate that we are this year celebrating our 75th anniversary, a significant milestone at the same time that the Declaration of Alma Ata is being recognized as having happened 40 years ago. So both significant events, and the reason that I think that they are related is that what Shoko stands for is really embodying the views of the model of health for all, and trying to really action those ideals. So it's great to see a lot of alumni who might have been involved in Shoko in the past. Shoko was founded in 1943 by a medical student, Andrew Kinnear, who in the December of 42 was working as an ambulance driver in Kensington to earn money to pay for his school fees. And he, while working there, recognized that there was a lot of health disparity compared to where he was training to where he was actually driving around the ambulances. Together with a faculty member, a Dr. Golda Seltzer, looked to establish the first students-run clinic. This Kensington Students' Clinic was founded in 1943, and from then Shoko has just grown from strength to strength. In 1945, the second clinic was established, and today we operate more than 10 clinic sites, serving more than 4,000 patients a year. What we offer is a free primary healthcare service. We run mobile clinics that offer screening, clinical assessment, dispensing of pharmaceuticals, as well as testing for HIV, pap smears, and we've recently rolled out our first family planning offering. All of this is run by students. So a student leadership team, one of my team members is there behind you, Peace Francis, Student leadership team, nearly 750 student volunteers every year, and seeing more than 4,000 patients, which means that very few students will graduate from the University of Cape Town without having participated in a Shawko clinic. We have a number of portfolios, everything from a new health and rehabilitation portfolio to mental health and international clinics program, rural health care, and a new research program as well. But with this being our 75th year, something we're really trying to focus on is innovating to make sure that we can stay relevant for the next 75 years. We believe our model works because it's student-led, but it's based in communities. So that means that we are always held accountable by the patients that we are serving, and we let them define what our service should become. So this year, some of the innovations that we have implemented is, for the first time, establishing a 750-kilometer trip for Shawko. So this is something you might have seen, where we took all of our Shawko mobiles and a group of 50 students on a 4-day trip during the school term to 4 sites around the Western Cape to try and offer mobile clinic services to communities that need them. So we traveled to Williams, Swellendam, and Ceres to offer clinics to nearly 750 patients, all free of charge, and again run by students and supervised by medical doctors and supervisors. Some of the other things we've done this year is we have established a new digital data capture system, which is one of the first of its kind, meaning that all patient data is paperless. And we have it HREC approved, which means that we can now start publishing student articles based on the data that we capture. So all of these sort of innovations that we've put in place aim to keep Shawko relevant for the next 750 years. If some of you were walking around campus, 750, yeah. If some of you were walking around campus, we had a mobile out in front of the IDM. This is one of the mobiles that we use to run our clinics at the sites. So I hope you were able to check that out. I would really encourage you to learn more about Shawko, to make contact with us. Our website is www.shawko.org, and to really learn about the innovative work that students are doing to keep Shawko relevant. So thank you very much for letting me have this opportunity.
Yeah, very good work there. And at this point, I'm going to ask Dr. Stuart Saunders to just share with us his reflections over the past 65 years of graduating from the faculty. Stuart.
Thank you, Bongo. I think all of us must have been most impressed by what we saw this afternoon. The faculty seems to me to be in a very good shape. I was professor of medicine before some of you were born, and so I will speak looking through that prism at the faculty. The original clinical professors were Saint in surgery, Crichton in obstetrics, and Faulkner in medicine. Faulkner resigned to become the Vice-Chancellor and was succeeded by Brock and Foreman, who were appointed jointly. Frankie Foreman was a remarkable clinician, and he was the original Google, because if you raised a problem, he would refer you to a journal 10, 15, 20 years before, and he'd almost certainly give you the page number. It was incredible. He was the physician when Faulkner was the professor, and Saint was on holiday in Gordons Bay. And Saint phoned Frankie and said to him that he had acute arthritis in his knee. And the foreman said, "Professor Saint, you've either got gout or gonorrhea." The Saint's reply is not on record. But I can tell you it was gout because I saw Saint when he was in his 90s and he had acute gout. Now, we owe a great deal to those people. They created an atmosphere in the faculty which was characterized by camaraderie, by working together, not in isolation, but as a family. And this is quite unique. Those of us who've worked in medical schools and hospitals overseas know how rare this is. And it's one of the strengths of the faculty. Brock was a remarkable man, the father of research in medicine in South Africa, and he said to me when I succeeded him that physicians in the teaching hospital, in the faculty, first responsibility was to their patients. Their second responsibility was to their students. Their third responsibility was to research, and the fourth was to administration. And he greatly emphasized the importance of doing research. The difference between a full-time specialist and someone who's in private practice must be that the full-time specialist is making a contribution to knowledge. That is what makes the difference. And I believe that again has been one of the strengths of this medical school. The link between the patients and the research. We saw that this afternoon at the Institute of Molecular Medicine, how important that is and how well that is being exploited to the benefit of the patients. So from where I stand, I think that this faculty is in a good shape.
Thank you very much, Stuart. We are in the good shape because of the support of our alumni, among others. At the time of the centenary, Marion set up a very successful campaign of drawing alumni and others to invest in building the future of the faculty. And quite a few of those alumni made significant contributions to the fund that would help us to achieve that. Behind me here is a wall, a donor recognition wall, that we're going to unveil together with Marion in a few moments. But I'd like Marion to just say a few remarks about the event of the centenary before we do so. Marion.
It comes down there. That's what I know. Good afternoon, everybody, and especially want to acknowledge Professor Saunders and JP, who were leaders in this faculty, besides everybody else. I remember Dr. Burns, I can't see where you are, you taught me in A5. And Prof. Saunders taught me in D6, but and I'm sorry I'm going to digress a bit because that's my habit. But it would be wonderful to see how many of us here were actually taught by Prof. Saunders. I want you to raise your hands. We haven't done badly. So 2012 was a significant year for the faculty because not only did we celebrate our centenary, but that was the year that the faculty achieved 46th place in the world of medical faculties right around the world, and this wasn't just on the African continent, so it was phenomenal. We did many things. We looked back, we actually color-coded the Centenary, so we looked back and we called that the blue frame to reflect on the past, and we tried to do that as comprehensively as possible. We did a lot of celebrating the present, and we had a gold color for that. And then we also, the red color was the one that was going to look at building the future. And so that campaign not only tried to reintroduce our alumni and our colleagues to the faculty, and like you observed, Prof. Saunders, they were blown away by the achievements over time, and all to the credit of the staff here. But what you didn't mention was your legacy as Vice Chancellor, which was very significant at a very significant time, and we appreciate that very much. I think maybe the younger people here won't know just exactly what you did to stand up to the horrors of the apartheid state, so we do appreciate that. So we did that. We had a concert, and the concert was in the Baxter, and all the performers were from the faculty, whether they were support staff or academics or from every department, and we raised a bit of money, but we mostly raised lots of fun. But then we had the appeal, and many of our alumni particularly contributed to that appeal. And so I think, as the Dean has pointed out, the wall behind us is a tribute to the alumni who made those contributions, but there's also lots of space going that way. So all offers are welcome, US dollars and euros particularly. So Bongani, I think maybe this is the moment. So come and see. Come this way, you can't see if you're on the corner. Can somebody push Lenny?
He doesn't.
She doesn't want to be pushed.
I can hold. Do you know what is this?
It's something phenomenal. No, I can walk. Good for you. Somebody click the button.
No. It lost.
So congratulations to the Dean and the support team from Comms and Marketing and the rest of the faculty. This is a great job behind this week.
We're just pulling the curtain.
You're supposed to hit it with champagne. That's for sure.
Yeah, so this is the...
Wow. Beautiful.
Yes. And as Marin has said, there is an opportunity for all of you to make a contribution, preferably in the gold level, at least $10,000. So, mainly for undergraduate students. We really appreciate this, and we are with this also engaging you to support the faculty as we go forward into the future. So I think at this point it just remains for me to say that there is a lot to see in this room. There is some information on primary health care. There are the photographs there, and then there's still refreshments back in the back club. So thank you very much to everybody for coming. We look forward to seeing you again in the faculty. Thank you very much.
Thank you.